What social media gets completely wrong about a hair transplant and where they misguide you. Getting a hair transplant is not as simple as getting a haircut done. It has a post-operative recovery period. The real hair restoration is not just a before and a after picture or a reel. First, the recovery. Sometimes your forehead can feel tight, sometimes you can feel a little itchy, sometimes you may even get some amount of swelling, and you have to be prepared for this. Second, density expectations. So this is very important for patients to understand. You may not get your highest density in the very first sitting. You may sometimes need another additional smaller procedure. So do understand this fact too. Thirdly, the limitation of donor area. If there isn't enough hair in the back, it's impossible to cover the entire scalp. So if you're going to your surgeon, asking him to cover the entire scalp, do understand the limitations that you have, for example, less donor area. Having no post-operative care or any kind of medications. Yes, transplanted hair are in a certain way strong and will remain for a number of years, but the existing hair are still prone to fall because of your genetic ability or because of the environmental or nutritional factors which are there. So yes, you will have to take care of the existing hair, and you'll have to repeatedly follow up regularly with your surgeon so that you make sure that your regular hair or existing hair will not fall. So yes, you may need maintenance treatment like PRP, GFC, exosomes, growth factors, or some other treatment. Another misconception that the hair will grow instantly. It's not a wig that you're getting done on your hair. It's a transplant. The hair will take minimum 4 to 6 months or maybe even longer, as close to 1 year, for it to grow completely. And another factor, that they should look natural. Here, your selection of surgeon expertise and the procedure is crucial. Sometimes people grow hair, the direction angle goes wrong, the hairline is wrongly designed, and it just doesn't look natural. So yes, if you are considering a hair transplant procedure, do know that there's going to be a post-operative recovery period. Consider a clinic or a surgeon or a method where you are sure of getting good natural results and high density, as close as possible to your natural density in the very first sitting. Call us, do find out more about hair transplants or hair restoration procedures. Thank you.